Hi, Assalamualaikum warahmatullahi wabarakatuh, and hello everyone. So today on Neurodegenerative disease topic, we have choose Alzheimer's disease and also Huntington disease. So stay tuned. So the definition of Alzheimer's disease, it is a progressive disease that will destroy memory and other mental functions. This is the most common cause of dementia.
Alzheimer's disease is associated with neuronal death throughout the brain, which can be extensive enough that the region of the brain appear atrophied or shrunken compared to a healthy brain. A hallmark sign of Alzheimer's disease is the formation of clusters of misfolded protein both inside and outside of neuron. One of these proteins, amyloid beta protein, is found in the extracellular space around neuron in a healthy brain. During Alzheimer's, however, misfolded form of amyloid beta clumps together in deposits called amyloid plaque. Another protein called tau protein, which is normally found inside neurons and involved in maintaining neuronal structure, is also found in misfolded state in Alzheimer's. It accumulates inside neuron in bundles called neurofibrillary tangles. Although amyloid plaques and neurofibrillary tangles are hallmark signs of Alzheimer's disease, it is unclear if they contribute to neurodegeneration or a part of the brain response to it.
Memory loss will be increased and confusion will be start. Difficulty to performing in familiar tasks. Poor or decreased judgment will lead to a bad decision, and problem with the abstract thinking and couldn't think logically, losing things or misplace them in odd place, changes in the mood and behavior, loss of potential and sense of initiative, difficulty organizing thought and thinking logically, difficulty with language such as problems with reading, writing and working with numbers.
So, I'm going to talk about the diagnosis for the Alzheimer's disease. Alzheimer's disease will conduct tests of a memory, problem solving, attention, counting, and language. Number 1. Carry out standard medical tests such as blood and urine tests to identify other possible causes of the problems. Number 2. Perform brain scans such as CT scan, MRI, and PET to rule out other possible causes of the symptom. Number 3. Test physical and neurological exams such as reflexes, muscle tone strength, sense of sight, coordination, and balance. Okay, now I'm going to talk about the management for the Alzheimer's disease. Number 1. Always keep the keys, wallet, phone mobiles, and other valuable things in the same place at home so they don't become lost. Number 2. Keep medication in the secure location. Use a daily checklist to keep track of the doses. Number 3. Arrange for finances to be an autonomic payment and automatic deposits. Number 4. Have the person with Alzheimer's carry a mobile phone with the location capability so that the caregiver can track its location. Just like now, we have Find the iPhone. Number 5. Install the alarm sensor on the door and the windows so that we can notice if they ever leave the house. Number 6. Make sure regular appointments on the same day at the same time much as possible. Number 7. Use a calendar or whiteboard in the home to track daily schedules. Build the habit of checking off completed items. Number 8. Remove excess furniture, clutter or throw rugs. Number 9. Install sturdy handrails on stairways in the bathroom or the restroom. Number 10. Ensure the shoes and slippers are comfortable and provide the good traction for them.
Hello, welcome. So, we come to the second topic, it is Huntington disease. So, what is Huntington disease? Huntington disease is inherited disease that causes the progressive breakdown or degeneration of nerve cell in the brain. So, the Huntington disease will affect the ability and usually result in movement, thinking or congestive, and psychiatric disorder.
Hi, hello. So today I'm gonna talk about the etiology of Huntington disease. So Huntington disease eventually occur at our number 4 chromosome in our bodies since we have 23 chromosomes. The Huntington disease is caused by a mutation in gene for a protein that called Huntington. The defect causes the cytosine, adenine, and guanine, or we call it as CAG, for building blocks of DNA to repeat many more times than is normal. So each child of a parent with Huntington disease have 50-50 chances of inheriting the Huntington disease.
In this disease, usually cause movement disorder, cognitive and physiatric disorder with a wide spectrum of signs and symptoms, which symptoms appear first varies greatly from a person to a person. Some symptoms appear more dominant or have a great effect on functional ability, but that can change throughout the course of a disease. The movement disorder associated with this disease, which can include both involuntary movement problem and impairment involuntary movement, such as involuntary jerking or eating movement, muscle problem such as rigidity or muscle construct, slow or abnormal movements, impaired gait, postural balance, difficulty in speaking and swallowing. Impairments in volunteer movement rather than involuntary movement may have a greater impact on person's ability to work, perform daily activities, communicate and remain independent. Cognitive impairments often associated with this disease, which include difficulty organization, prioritizing or focus on the task, lack of flexibility or tendency to get stuck on the thoughts, behavior or action preservation, lack of impulse control that can result in outbursts, acting with thinking and a sexual promise, lack of awareness of one's own behaviors and ability, slowness in progressing thoughts or finding words, difficulty in learning in new information.
So for
Psychiatric disorder. The most common psychiatric disorder associated with this disease is a depression. This isn't a simple reaction to receive a diagnosis of this disease. Instead, depression appears to occur because of injury to the brain, subsequently changes in the brain function. Sign and symptom which can be included for this: feeling of irritability, sadness, apathy, social withdrawal, insomnia, fatigue, and loss of energy. Frequently thoughts of death or dying or suicide.
Genetic tests, or known as direct genetic tests, is the most effective and accurate method of testing for HD. It counts the number of CAG repeats in the HD gene using DNA taken from a blood sample. The presence of 36 or more repeats supports a diagnosis of HD. A test result of 26 or fewer repeats rules out of HD. First, it will show the progressive atrophy of the head of the caudate nucleus and also some degree of recruitment. Later on, as the disease progresses, the patient also going to develop diffuse cortical atrophy. There is no treatment to stop or reverse Huntington disease. However, there are some medications that can help keep symptoms under control. Treatment for Huntington disease include the drug tetrabenazine to help control the movement and antidepressant to treat psychiatric disorder.